Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We all know that Alzheimer's is a word years ago people could hardly pronounce it, and now it is seems it affects everyone in everyone's family somehow or friends. And it's always good to have a specialist on. We have Dr. HAZEL WILEY, who is, of course, at the Memory Disorder Center over there at Broward Health North, because we need to get people who really know what's going on. The biggest problem I've had, Dr. Wiley, is where people don't have some memory loss, and the first thing they do is they say, oh, he has Alzheimer's. Doesn't that bother you?
Absolutely. There's many types of memory difficulties and memory disorders other than Alzheimer's or dementia. So absolutely, it is a bother.
And you did tell me something earlier, that there are actual screenings compared to going and actually having a full test. How does that work?
At Broward Health North Memory Disorder Center, we hold memory screenings. So if people are having complaints of memory difficulties and aren't quite sure what is happening, they can come in, just have a memory screening, and from there we can go forward and evaluate if they need further care or further testing, or if other issues are what's causing their difficulties.
So just talking about that particular subject, have you found people who don't have Alzheimer's but are sure they do, and then when you finish testing them, and what causes all that?
Absolutely. We do see patients as well who have memory difficulties that don't receive an actual diagnosis of dementia or Alzheimer's. Sometimes we can have people who come in who feel that they're forgetful, they're having difficulties completing their work, they're having difficulty completing their obligations at home. They come in, they go through the screening tests, they go through the testing, and it actually turns out that it's just anxiety or too much stress or having too many things on their plate at once that is causing their forgetfulness and their lack of attention, and not actual diagnosis of dementia. And then at the same time, we see a lot of patients who do end up having the diagnosis of mild cognitive impairment or a mild dementia.
And just talking about this, I'm going to jump forward a little bit, is I have a friend who is in her late 40s, and she just kept saying to me, I don't think I can keep working because I just can't stick on something and remember. I said, oh, I'm sure that's, you're just tired, as you were just saying, maybe you're under stress. And it did turn out, after she was tested, that she actually is one of the early Alzheimer's. Are you finding a lot of people like that?
We do. We do see some patients with mild and early stages of dementia, but we also see them with the other stages too, moderate or advanced stages where they haven't received the appropriate diagnosis through other doctors, or they haven't had the correct evaluation. So we really are seeing all stages of dementia and some mild cognitive impairment, which are stages of memory difficulties prior to dementia diagnosis.
One thing you said, though, before we got on the air was about clinical trials. And she now is involved in a lot of clinical trials because she feels that they're finding all sorts of things that are helping her already. Talk about what that is, and who would be the person listening now, who would be the appropriate person to be in a clinical trial?
Well, there's clinical trials available for all types of dementia patients and even mild cognitive impairment patients. And really, it's good for everyone to be evaluated. That's one of the positive things about the Memory Center, is that you can come in, have the evaluation, and see if you qualify for one of these research trials. They're so important because these trials are going to help change the future for dementia. Right now, we don't have a cure. We only have medications that can attempt to slow progression of dementia or Alzheimer's. And if we can get more research patients, if we can get more trials done, we can find options and ways to stop the process and hopefully even maybe reverse the progress of dementia in the future.
That's an excellent hope, isn't it? That's
Absolutely.
what we all family members want, that as well as the person. Let me give everyone a phone number. If you want more information about whether you want to take the screening or you want to talk to someone there, you want to talk to Dr. Wiley or Dr. Ishmael, or Shelley Greenberg, whom I've known for so long. Someone there will help you. Don't be afraid. Just call them. Tell them what you're concerned about. This is a phone number. Remember, it's Pencil Talk Radio, so get your pencils out. It's 954 954-786-7392. 954-786-7392. And the benefit of this is a lot of this, of course, will be paid by Medicare. And the other thing that I love is they do have support groups. So let's say you already have had someone in your family who's been who has Alzheimer's and it's been proven. Then you have a place to go where other people have this, and you can talk to family members. And I love support groups. And you as a neurologist, I would think, would really appreciate what that is.
We have great support groups. We have a CAP program. It's Caregiver Assistance Program. It is available to the caregivers. We offer it every month. It's a 4-day day lecture, and it's offered in the morning and in the evenings, depending on which month it is. And it's a great way for different family members to meet other family members who have dementia, and so they can share experiences and share stories and realize that they are not the only ones who are going through this. Currently, there is over 5 million Americans diagnosed with Alzheimer's and dementia in the United States. So there's a lot of people out there who need the support group, who need to interact with each other and share stories and realize that there is a lot of support. We also have an early stage support group. This is a little bit different because this is not just for the caregivers, but this is also for the patient. So the patient and the caregiver or the spouse can go to a support group together. And these are for the patients who have the early stages of dementia.
I'm sure that's a very interesting discussion because the person who has the Alzheimer's probably feels that maybe they're embarrassed and they don't know how their family member feels, and then they can be with other people. I love that. That's a great idea to keep them together. The other thing that I think is probably new now, but I mean, it's been going on, but years ago, maybe 25, 30 years ago, people could not actually be tested for Alzheimer's. And everyone said you had to wait until someone dies. And tell me about that. What's happened?
Well, the official confirmation is absolutely still the same as before. It's confirmed on autopsy. But we still do all the other tests, the MRI of the brain, a CAT scan of the brain in some patients, PET scans, neuropsychometric testing, extensive blood work that's necessary. These all point towards Alzheimer's, shows us changes that are consistent with a diagnosis of Alzheimer's or a diagnosis of the other types of dementia. Alzheimer's is the most common form at this time, but we can also see the other forms of dementia via imaging, lab work, and then the neuropsychometric testing, which is an extensive test performed by a neuropsychologist. And all of these tests are things that we usually offer patients when they come to the memory center.
And so people, the first thing someone thinks about, of course, is I've lost my keys, I can't find them, or I don't remember someone's name. Why don't you kind of clear some of that up? I mean, I love to talk about that, but you're such an expert. Please do that.
Well, absolutely. Losing things, misplacing things, forgetting people's names, forgetting numbers. Those are some of the common first symptoms that people with memory difficulties complain of. But we have to always remember that these are also some things that people complain of who don't have dementia. That's why it's so important to go through the testing. It's so important to be evaluated either at the Memory Disorder Center or somewhere that they are knowledgeable about dementia.
And that's why I was so glad to know that actually in Broward County, this is the only memory disorder center. That says a lot. I mean, you
Absolutely.
have to be very careful who you go to. Make sure when you talk to a neurologist, ask them point blank, have you had a lot of experience with people who have Alzheimer's or other dementia? Because I don't know how much experience you've had, but you can see that just like there are a lot of doctors who deal with older adults and they call themselves geriatric physicians. They're not really, but they just see a lot of older people. And I'm sure that's what's happening. And so you actually went to school, and this is your specialty. And so let me ask you that while we're on that subject. Why did you do this?
It's a great population of patients. It's a patient population that requires a lot of attention, and they're very thankful and very appreciative, and they just want help, knowledge, and compassion. And that's why I like this patient population.
You know, it's interesting that I had a caregiver on the radio show a few years ago, and the caregiver she loved her husband very much, but he really didn't realize, and he lived at home, that she was his wife. And so sometimes he would say, "Listen, I think you have to leave now because my girlfriend's coming over." And she went through all this, and what I loved about it is that she loved him so much to understand that this is a disease. This is not real, that someone's doing something wrong. And so, and then sometimes after she told me, then she would say, "Well, when your girlfriend comes, I'll leave." And then later, he, of course, totally forgot that. Isn't it true that one of the Supreme Court judges, yes, the Supreme Court judge, who's a woman, and she gave up judgeship because her husband had Alzheimer's, and she actually went and decided to take care of him. So there are a lot of ways you can take care of someone. Do you have to always have someone in a nursing home, or what can you do?
Absolutely not. There's lots of services that can be brought to the home. And we have 2 social workers at the Memory Disorder Center who are available not only for our patients, but for any patient who wants to call over and get some information, or any caregiver who wants some added information that will help keep patients at home, keep them safe, keep them mentally entertained, physically active, because these are all important things that will help in the patient care. You don't have to be a patient to have some of these services. We have this, like I said, the social workers, we have the support groups, we have a driving assessment program, which is another very important factor. Usually when people are having cognitive issues and difficulties, we like them to have a formal evaluation. And the first part of the evaluation of driving is through a test, a computerized test, which is a very simple test, does not require any need of knowing how to use a computer to do the test. And if that test is passed, then you go with a trained person out to the road to confirm whether or not it is safe for you to drive.
I'm really glad you brought that up, because that's been a very big issue with people who don't have Alzheimer's. They don't have dementia. They just shouldn't be driving anymore. Maybe their vision's impaired, something. But boy, when you want to take away those keys, that's like taking away their heart. And if they've been out driving for, of course, you're young, and I'm young. I'm a little older, of course, but you said to me, "You can't drive anymore." I said, "Are you kidding? What am I going to do now?" Right? But actually, when my husband's 93, and about a year ago, I thought that I didn't think he could be as sharp if something happened that was an emergency. So I found him a driver, someone that takes him everywhere he wants. He goes to meetings, he goes to things, and I've really heard, though, from a lot of people who are having a terrible time getting their spouse or their family member to do it. So this is my suggestion, and I hope that you can do something like this. As a physician, one thing about older adults, they adhere to what physicians say. And if you write a prescription, they will take it. So my suggestion is write a prescription to tell them to give up their car. Please think about that, because I've heard this. This is one of the hottest topics with the boomer population and their family members. I'm sure you've heard it.
And absolutely. And the driving assessments we do is not just for the dementia patients. If there's other patients who families are concerned that they're having driving difficulties, they are absolutely able to come as well to have an assessment for their ability to drive. So it's not just for patients with dementia.
And what did you call that program?
It's called Drive Able.
Drive Able. That's very good. And these people don't have to drive in front of you. They just come and sit down?
Correct. The first part is a computer part where they're testing your ability to focus, your attention, your speed, and what you're noticing on the computer screen. So there's no need for any type of computer skills. It's just pressing a button. That's all you have to do. And once you pass that portion of the test, then there is a person who goes with you in your car and evaluates your ability to drive out on the road. And then after that's completed, then, as long as you've passed, then you've been cleared to drive.
Now, that's kind of strange to hear that, because if someone wanted to do that with me, even though I'm a good driver, I'd be very nervous. Oh, my goodness, that's so, but I guess
If you don't pass the first portion of the test, then you obviously don't go on to the second portion of the test. And once we take that part away from a family member, so now the caregiver doesn't have to say, give me your keys. They've failed a formal driving evaluation. It makes it much easier. And the blame is not any longer on the spouse or the child. The blame is now at the center who did the testing. And it makes it easier for the children, for the spouse, to remind them, they said you couldn't drive, not me.
That's a wonderful program, because my mother passed away when she was 94, and we had we had gotten rid of her car when she had a few accidents, and she said it was the police's fault. And and she was such a wonderful woman. And so, but until she died, she always said, I really should be driving. Take me to the car place. I want to buy another car. I mean, because, you can see how it feels. And I'm sure that's very true. Well, this is really great, Hazel. Dr. Hazel Wiley, and she is a neurologist at the Broward Health North. And we're really going to be building a very big center now. I guess things will stay, but you're going to get a lot of new, up-to-date place that's even better than it is now, I have to assume.
Correct. They are building a new Neuroscience Center. So we will still be at Broward Health North. We will just be located in a different part of the building once that is all completed in the future.
Maybe at this time we ought to talk about Dr. Todd. I know he's not here, but he is so famous, and he is such a wonderful man. I knew you said something about that when you were in school. Why don't you repeat that?
Well, Dr. Todd used to be a lecturer at Nova Southeastern University. That's where I went to medical school. And all the students were always mesmerized when he came to do lectures, because he's such a fascinating speaker. And I used to rotate with him as a medical student. So I previously would come to the memory center as a student and shadow with him and watch him evaluate the patients.
And that must have been very interesting. You were very fortunate to do. Did he do that with a lot of students?
Absolutely, for many years.
What a nice thing. And so you really you learned under his tutelage. And he's still there, though, isn't he?
He is no longer there.
I did not know that. So he retired.
Yeah. He is gone from the memory center, but he is not retired, from what I have been told.
Oh, okay. So Dr. Todd has now gone on to maybe bigger and better things. Maybe he's just fascinating everybody. But I remember we had a very big meeting, and he was the keynote speaker, and we were falling off our chairs in laughter. I mean, he would say things, and actually some of the other doctors would open their mouths and say, oh my gosh, because he would just say whatever he believed. And he'd been doing it long enough. So that's good. So you had a good mentor, Dr. Todd. Okay. So, Dr. Wiley, in your dream of all dreams, I'll bet that, and you're young enough that you could really see a difference in whether it's going to be curing Alzheimer's, but it'll be something. What would you like to see if you could write it on a pad?
I would like absolutely to see, I think what everybody else wants to see in the field is to find a cure and to find ways to reverse memory loss.
And memory loss, and do you think that, well, let me just go back on this. For years, the brain was a second-class citizen. I mean, really, it wasn't, people didn't say, it was always the heart, or it was cancer, it was always something that, we were having knees and hips, and it's all important. But the brain now has taken on such a prominence.
Absolutely. There's so much research going on right now with brain, with dementia, with different areas within the brain and within neurology. That's why it's so important to have an evaluation and come be part of the excitement and be part of the research to find changes, make changes for the future.
I'm sure that you know in your profession of neuroplasticity, because I had one of the main authors of his book, something about the brain that heals itself or something, and he was on my show a few times, and I've been fascinated by that the brain really now can take places that maybe the cells have died and then move over. And so this might be some of the results that you're looking for.
Absolutely. Absolutely.
So the ages of the people are, we talked a little bit about people younger who have it, but what typically is the age that you see that someone definitely has Alzheimer's?
Well, the majority of Alzheimer's patients are going to be 70 and above. 65 and younger is what we call our early onset. It's a very small population of people. So of the over 5 million people with Alzheimer's, it's a very small percentage who have early onset. Early onset is those who are diagnosed younger than 65. That shouldn't be confused with mild Alzheimer's. When you refer to mild, it's referring to mild symptoms versus when we refer to early, we're referring to a young age patient. So a patient who's in their 60s would be an early onset patient. And then a patient who has mild symptoms we refer to as a mild Alzheimer's or a mild dementia patient.
So clarify that. What is the difference, though? What would a mild Alzheimer's patient look like compared to what's the next one?
So mild Alzheimer's or mild dementia are usually mild symptoms: forgetfulness, losing things, misplacing things, repeating yourself, and still being able to complete daily activities, still being able to dress yourself, bathe yourself. Some people are still working with difficulties. When we transition into the moderate, we see more impairment of the daily activities, more assistance with things, needing help, reminding people to do their daily hygiene. At that point, usually we don't see people driving anymore. They're getting lost. They're having difficulties in their moderate stages with finances. They're needing their family to take over those obligations. And then when we go from moderate to advanced, we see a lot more difficulty with, mobility. Now we're seeing almost full assistance with activities of daily living. This is where we usually see some of the transition to nursing home. A lot of times we say we don't have to send our family members with dementia to nursing homes. But when we transition to the advanced stages, it becomes very difficult for caregivers to care for their family at home. And that's where sometimes nursing home placement is a good option, because there we have people who are trained to be able to care for the patients appropriately.
So I can hear the pain in your voice when you say that, because it must be very hard for you to tell a family member that I think it'd be better off for your loved one to be in a nursing home.
Absolutely. It's very hard. A lot of family members want to keep them in home. They want to keep caring for them, and they feel that they have failed because they're giving up. I gave up on my father. I had to send him away. And we have to counsel and educate family members that they're not failing, that they are choosing the nursing home placement because they continue to care for them, and that this is just the next step because they're unable to perform those duties. And for safety of the patient, it's better to go to a place where they're able to care for them appropriately.
Now, when someone has severe Alzheimer's, does it always look the same? For instance, I know that some people get in fetal positions, but some people may have other situations. They walk all the time. You can't get them to stop, and they keep trying to get out.
It does vary depending on the patient. It depends on the areas of the brain that are injured. It also depends on their medical history. If you have someone who is healthy, except for Alzheimer's history, then you can see that person walking around and more active physically. But then when you add on top of that people who have heart conditions or diabetes or have fallen and had hip fractures, that also changes their abilities and what they can do. But you'll see that their cognition part in both of those advanced dementia patients are pretty much the same. When we're in the advanced stages is where we see that people aren't recognizing their families, they're not talking much, they might say a word answer or might not use any answers at all.
Oh, those are things to really look out for. That's why it is so important we can go back to when we first started this conversation, to have an assessment. I mean, you can't probably foretell the future, but you can still see, you've seen so many people, where is this going?
That's why an assessment is so important. We have to get the assessment done. We want to get the assessment done early when people start having symptoms, so we can plan ahead and have family prepared, plan ahead for the future. Things as what are their wishes medically? What are your wishes financially? What are who's going to be your power of attorney? Who's going to speak for you when you can no longer speak for yourself? And when we diagnose this early, we can plan ahead and have all this ready so that later on family isn't wondering what would you have wanted, but it's already there and ready.
That's excellent. Oh, yeah, I'm so glad you said that. So get yourself a very good lawyer, an elder law attorney. Make sure that you have this thought out, because we do know that people can be taken advantage of when they have Alzheimer's. Nowadays that, there's a person who maybe lives alone, has Alzheimer's, and they have a caregiver, and they don't know who the caregiver really is, and whatever could happen, right? It's a very serious disease. Well, I'm certainly hoping, really hoping, that this disease is like many of the other diseases. Maybe we didn't cure cancer, but we certainly are getting a lot behind it. Same thing with heart disease. I think it's more in its beginning stages. Alzheimer's been around, but not many people, even 5 million, have really understood the consequences. And I'm glad you do, and I'm glad that you're there and that you're going to be adding to the great organization that is growing there at Broward Health North for this Memory Disorder Center. And I certainly do thank you so much for coming in and sharing your feelings with this.
Thank you so much for having me.